Hi guys, my name is SYBILLE GUICHARD, founder of the C.A.R.E for Crohn's Foundation. I'm here with my lovely lady Crohnies, and we're going to talk about a few things today. A lot of people don't even know what Crohn's disease is to begin with, so we're going to bring out some awareness, let you know how we still live our lives to the fullest with Crohn's disease. So first we have Kelsey, Alicia, and Christy. And we all have Crohn's disease. We've all been diagnosed at different times of our lives. Some of us fairly new diagnosed, and some of us for years. I myself has had Crohn's disease for 14 years. Kelsey, how long have you had Crohn's?
I was diagnosed in 2004, so when I was 13 years old, it's been 10 years.
I was diagnosed when I was 17, so actually it'll be 3 years, November 16th of this year.
I was diagnosed around 16, 17, so about 7, 8 years.
Okay, and some of us really who suffer from Crohn's disease, I notice a lot of times that none of us really know what we're supposed to do to help ourselves as far as eating the right foods or trying to help subside our symptoms. What most people don't understand is that Crohn's is a bowel disease. It affects anywhere in your GI tract, from your mouth to your anus, and that's swelling of the intestine or anywhere in that GI tract. So a lot of times we can't eat and we lose weight really rapidly because it's painful to swallow anything and to digest anything. When you guys were first diagnosed, what were your symptoms that you could have had? Kelsey?
Alright, my story, I don't know how it is compared to other people's, but I'll just let you know. Mine was kind of unusual when I was really young. About 8 years old. Well, I guess I can go back further. My mom used to say she could tell something was wrong when I was a little kid. I had eczema. I had some issues with my mouth. Like when I was at 8 years old, I was going to the doctors and telling them it hurt to eat food. My mouth hurt. I had like cracks in my tongue, and they didn't know what it was. Looking back, that was all inflammation. Inflammation presenting on my skin, in my mouth at that point. But after my symptoms started to progress and I had nausea, I had constant diarrhea and pain in my stomach, the doctors did some tests. They did blood tests, they did a colonoscopy. And so from the ages of from 8 to 13, it was all questions. Like, we didn't know. I was sick, I was underweight, in pain, no answers. And then finally those series of tests, the blood tests, the CAT scan, the colonoscopy, they all led to show inflammation inside of my intestines. And my pediatrician figured out it was Crohn's because she had just diagnosed another kid about my age with Crohn's.
Well, I see that a lot. That's the kind of the same thing that happened with me, because ever since I was a baby, I always had issues digesting food, but we never knew that I had an issue. Like, my mom would have to pick me up from school because I was constantly vomiting, and they would send me to the hospital, give me a shot to stop vomiting, and send me on my way. And the next day I eat a slice of pizza and it was the same thing, you know. So I had eczema too a lot as a kid, but my symptoms started to come around when I was 12 years old, and after 2 years of a lot of misdiagnosis, the pain progressed. At first it felt like a slight minor stomach cramp, and later it progressed into a stomach pain that I had to ball up into the fetal position no matter where I was. I could be in the middle of Walmart and I had to squat on the floor to hold my tummy. After massive weight loss, constant diarrhea, a lot of rectal bleeding and that. So after seeing so many doctors and my fevers every night and not being able to eat, extreme anemia, finally from a colonoscopy also, they were able to determine that I did have Crohn's disease. So what were your symptoms like?
Well, I'm completely different from you two. I had a perfect childhood, never sick, never had anything. I was perfectly fine all throughout high school, except when I turned 16. When I was 16, I started to get a lot skinnier and more fatigued. That was it. Nothing. Then when I turned 17 in August, I had such severe pain coming out of the left side of my stomach. And I, like you, I was in a fetal position and I couldn't understand why. So of course we went to the doctors. And she told me she didn't know what's going on, but you're 17, so she was thinking that maybe I'm lying, and I kind of, you know, doing a little something. She told me to go to the gynecologist. So I went, and he said, "Oh, you have a cyst."
Cyst where?
A cyst here,
somewhere
in my ovaries. That
I got diagnosed with that too. But
so I was like, okay. So I went to the hospital, cyst, burst, whatever. The ultrasound confirmed that, oh yeah, there's some clear liquid that looked like a cyst at birth. So that was it. That happened in August. School started, senior year, perfectly fine. October 31st, Halloween night, I got sick again, fetal position, and I was in the hospital for 3 weeks trying to figure out what was wrong with my stomach. Couldn't eat anything. I would throw everything up. Horrible. And after colonoscopies and all of the tests, CAT scans, x-rays, ultrasounds, finally they figured out that it was Crohn's. And to this day, it's I still don't know what it is. I still don't know everything. I'm still shocked. And to have it happen right in the middle of my senior year was probably like the worst thing ever.
Yeah, I can imagine. I went straight into high school, freshman high school, dealing with that, and a lot of times people don't even understand what's wrong with you.
It's already a big change going to high school.
Exactly. And what were your symptoms like?
Well, I mean, mine started around 16, but mine was just constant bowel movements, nausea here and there, and just rapid weight loss. And I was in sports, so I was losing a lot of energy. Around 17 is when I started getting more tests. They actually found 2 ulcers on my intestines. I was getting all different types of medications. I kept on switching until finally I started getting better. And then when I started getting better is actually when I got pregnant, and that's what made everything go away. And I really didn't get anything for another couple years, which when I got it again, it wasn't too bad, and then I didn't get it again until recently.
Right.
And now it's really bad again. But I really was in remission for a long time after my pregnancy.
And that's what I tend to hear. A lot of females with Crohn's disease always tend to worry about if in the future, if I were to want to have a baby, how would that affect my child? Would it be transferred over to the kid or anything like that? But there's technically, it's kind of a low rate that the child may be born with Crohn's disease because you have Crohn's disease. And I have asked my doctors, and they have told me that a lot of times the pregnancy puts your disease into remission for a long time, but there is a big chance.
If you're in like really bad inflammations, and you're actually at the time of conceiving, you're in really bad pain,
in a flare,
you have a high risk of miscarriage. It's only a third chance that it will actually make your pregnancy will actually make everything better.
Right.
You can take medication, but it can't be antibiotics or steroids, of course. And I actually wasn't taking medication because, like I said, it made me better. But some people, it's a very high risk pregnancy, and they miscarriage anywhere from the first couple weeks to 18 weeks. So.
Wow. Well, congratulations on having your child, though.
She's healthy.
Yes, that's awesome. Amazing.
That just reminded me, though, about the fact of where Crohn's comes from. So a lot of people will have that debate and say, oh, it's not hereditary, it's not genetic, or it's something with your diet. And for me, it's seemingly not my environment or my diet, because I had tried changing everything and nothing helped. And then I happened to be the first one in my family who was diagnosed.
Me as well.
But then after, when I started to go through all this, we looked, and like my mom has had intestinal issues, like more IBS, like irritable bowel syndrome with foods, but she didn't have like the inflammatory bowel disease. And then my grandmother on my mom's side had colon cancer. And then after I was diagnosed, recently my uncle on my mom's side was diagnosed. He had to have his colon removed, and now his son just got diagnosed with Crohn's. So it seemed like I was the only one, but now it's looking like something that's unexplainable. It probably is genetic.
Nobody in my family has had any problems. It's a gray area. Some people, it just comes, but I mean, my trigger has always just been stress.
Crohn's, it's not just a stomach thing. It's a stomach thing is first, but then it affects your entire body.
Right, because Crohn's is an autoimmune disease.
Yeah.
Your immune system is attacking itself. Like,
everything.
I struggled with losing my hair. This haircut is by choice, by the way, but I did, when I did have hair, I mean, I was losing my hair. There were times where my joint pains would be so intense, and my joints are so inflamed, and I would get these abscesses, like just these balls growing on my joints. I could not walk. I can't step my foot on the floor. It was just crazy because I can't walk, something that I do every day. I can't paint my nails. I can't use the bathroom. People think you're being lazy when you say you're tired, and it's not lazy. You're losing blood, your fatigue, and your body is attacking itself. It
what fuels you? Food. And when you don't get enough food, or when it doesn't process right.
Right.
Yeah, you don't have energy to do anything.
The nutrients go right through us.
And it's a constant battle between having a disease that's an autoimmune disease, causes malnutrition because you have absorption problems. You can eat something or drink an Ensure or whatever they tell you to do to try to like take your vitamins, keep your calories up. But when you're eating that and you have inflammation, you have bleeding, you have ulcers, it's like it's not absorbing. That intestine is not healthy. It's not absorbing at a cellular level of those nutrients and vitamins. So then there's all these other issues that combat from the disease, from the malnutrition, as well as when you're trying to battle it with medication, you have all these side effects.